Everyone. I'm just having my dinner. Hello, everyone. Happy Friday, and welcome to my channel. Let's see comments here. How are you all doing? Happy Friday, happy Friday, happy Friday. So this is going to be an educative one, and we won't be spending too long at all. So please like us to comment. Please like and share as you comment. Like and share as you come in. And I hope you've got your pen and paper. Okay. And if you don't have a pen and paper, I'll try and leave all the link of the information I'm going to be sharing with you. I'll leave it in the description box of this video once I'm editing it. So just a quick introduction. My name is Wemimo, and I'm also known as Thatmumof5. Oh, Choice TV is here. Hello, my friend. How are you? Happy Friday. How's everything? And how's work? So my name is Wemimo. I'm also known as Thatmumof5 and also known as TMO5 Candle Co. And if you're new to my channel, welcome. And if you're a returning subscriber, thank you so much for always coming back. So, just like I said earlier on in my previous videos, it's not all about gossip and no, all of that on my channel. My channel is practically everything. And when I say my channel is practically everything, it means that information like this, I'm going to be bringing it to you, okay? So I already did a sit down video while I was at work this morning, but I felt like, you know what, before I edit it and stuff like that, I just don't want to do that. So I'd rather just come live, drop the information out here, and then everybody can go on and read, to be aware of this information. So as you guys can all tell from the title there and also from the thumbnail, you guys see what we are dealing with. So what it's right out there is I'm hoping it's not going to be another pandemic. Okay, I'm hoping and praying it's not going to be another pandemic because this was how it took a while before we started to hear more information about COVID when COVID happened. So with this now, I said, you know what, there's been less news of it. So meanwhile, this information about this MPox, I read about it about a week or two ago on Instagram. And when I read about it on Instagram, it only shows that there was only 36 cases in Nigeria. So that was the only place I've read about it that it was available. It was they've only seen it so far in Nigeria. And I was like, oh, how can this information be in Nigeria and the news channels, the social media handles are not actually reporting it? So, like I said, I've read about it on the internet about a week ago, and then it popped up on my news notification again this morning again. So I said, like, you know what, it's high time I discuss it. So it's called just as a stuff I saw. It said there is in Nigeria alone there's 39 records of MPox cases. That is 39 people already have this MPox in Nigeria. So I'm going to read the write-up. It says that this will now also include declarations by travelers. So if there's anybody traveling into Nigeria, they will now, so the national, let me find the information. So if anybody is traveling into Nigeria now due to the outbreak of this mpox, the Nigerian Ministry of Health now requires all travelers who are entering into Nigeria to complete a health declaration form. Hello, President Shelu. So for instance, if I am leaving here to go to Nigeria, I will have to complete a health declaration form that I've not been exposed to this sickness, I've not been exposed to this virus, and I think it's just going to be like COVID, where you will have tested and you show proof that you don't have anything. So Paul said, oh my god, it's spreading a lot in Nigeria. It's spreading a lot. So now anybody who is entering Nigeria, regardless of where you are coming from, the Nigerian Ministry of Education of Health has now said that people have to do they'll have to do health declaration form. So now let's talk about this mpox because it's spreading really fast and it's already in Europe. Yes. It was because I saw the news that said it was already in Europe that I decided, like, no, it is not about Gbasgbos every day on this channel. It is not about gossip news. We have to come here and discuss it. And if you look at the things if you look at the way this thing is being spread, like, nobody can avoid it. I'm afraid to tell you guys, nobody can avoid it. But let's go back. So there's one case so far in Europe, and it is in Sweden. So the one case in Europe is in Sweden. So Sweden has one case of this mpox. It's in Nigeria, it's in Rwanda, it's in Congo, it's in at least 16 African countries now have cases of MPox. So it's spreading rapidly in Africa. Yes, it's spreading like wildfire in Africa. So for the fact that I'm bringing this information to you guys, there's no need to be worried. There's no need to be concerned. You just need to get yourself hello Pedro, how are you? You just need to get more information about what this virus is, how you can prevent it, how you can avoid it. I know, so which is why I am here for you. So now let's go. So I am on WHO website, so World Health Organization. They've actually declared it an emergency. So the World Health Organization has now declared MPox, formerly known as monkeypox, as global health emergency. So it's like a global warning to the world now that it's an emergency. So let's go to the key fact. If you're not able to write, you can save this video again so you can learn about it. So I'm reading so that I'm giving you guys first hand information from my laptop. So the key facts of this MPox. MPox is also known as monkeypox. It is a viral illness caused by the monkeypox virus. The monkeypox virus is a species of genus orthopox virus. Two different clades exist. So there's clade 1 and clade 2. So all of this clade 1, clade 2 might not make sense to any of us. Princess, just keep watching. I'm going to tell you how to prevent it and how people contact it, okay? So the common symptoms of this monkeypox are skin rash. If you look at the image on my thumbnail, that is what you get. That is what people experience. So common symptoms are skin rash or mucosal lesions. So mucosal lesions are like bumps swelling on your skin, and it has mucus. You know how people have pimples on their body, but it comes like boil and then there's mucus inside it. So that is what other symptoms you get, and this can last up to 2 weeks. So all these bumps, all these lesions can last up to 2 weeks, and then people will experience fever, headache, muscle aches, back pain, low energy, and swollen lymph nodes. So all of these symptoms, it's kind of like depicting COVID symptoms as well, but this is not COVID, right? This is MPox. So the symptoms is similar to COVID. So MPox can be transmitted to humans through physical contact. People contact it through physical contact. Okay, you can contact it if you are if you are in physical contact with somebody who is infectious. So some people might have it, but they might not be able to pass it. They might not be infectious. Okay, just like COVID, some people might have COVID, but because they have COVID, they don't show symptoms. So this MPox is like that as well. Some people will have it, but they will not show symptoms. Some people will have it, but they will not be prone to spreading it because their immune system is helping them fight it. So which means that they might have the MPox, but then they will not have this chicken pox, they will not have all this swollen thing, they will not have these rashes. In fact, they will not feel any cold. There are some people whose immune systems are quite good like that, but then don't be deceived. Just because they are not showing symptoms does not mean that some people might not be able to pass it. Some people might not show symptoms, but then if you involve in the ways that you can catch it, you will catch it. And some people, they might have this MPox, they might not show symptoms, and they might not be able to affect other people with it. So I hope you guys are understanding me. So it says here that MPox can be transmitted to humans through physical contact with someone who is infectious with contaminated materials or with infected animals. Even animals can be infected, or even animals can have it, and you can get it from animals. So if there's any of you that keep pets, if your pet goes out and stuff like that, there's a chance that your pet might have this MPox virus. Okay, so like people who have cats, who their cats go out of the house. So my house now, we have a cat, but our cat is not an outdoor cat. Our cat is an indoor cat, and we've had that cat since it was a baby. So for people who have cats or dogs who go out anyhow, so you have to be very, very cautious about your pets as well. So they said that I'm just sharing key facts with you right now. So guys, like this video as you comment, okay? Like and share, because this is an important information, and the more you like it, it's going to share it across so that other people become aware of it. So it says that laboratory confirmation of MPox is done by testing skin lesions material by PCR. So if there's anybody that has that bump on their skin, the way they can test it is taking a sample from that skin lesion. That's when that is on the skin. There's a way they will take a sample and test to be sure to check if that person could be infectious or not infectious. Okay, so here it says that MPox is treated with supportive care. Vaccines and therapeutics developed for smallpox and approved for use in some countries can be used for mpox in some circumstances. So there's a cure for it. That is like vaccination, okay? And it also said that, yeah, in year 2022 stroke 2023, there was a global outbreaks of mpox, which was caused by a strain known as clade 2b. So this mpox, this is not the first time that it's coming out. It's actually been before. So there was a case of it between 2022 2023, and I have to tell you guys that I was not even aware of it. I did not have a clue that this has actually happened before. So it says here that mpox can be prevented by avoiding physical contact with someone who has monkeypox. So monkeypox is a full name for it, but they've shortened it to mpox. Vaccination can help prevent infection for people at risk. So like I said earlier on, that there is vaccination for it, but I know most people might frown at, oh, another vaccination, because there are still some people out there who don't believe it, who did not believe in the COVID vaccination, even with the way COVID was about. Some of majority of people did not take that COVID vaccination. For me, thankful, I was lucky. Nobody in my household got COVID, but we still ensure that we got the vaccine. Okay, so for here now, they're saying that there's a way to prevent it, and preventing this is avoiding physical contact, and that physical contact comes in a lot of ways. Okay, physical contact comes in a lot of ways. So they've said here that, so this information is on World Health Organization website. Okay, they said that vaccination can help you help prevent the infection for people who might be at risk. So in these cases, people who might be at risk might be people who have maybe weak immune system, people who have maybe underlying health condition, maybe respiratory illnesses that they're already dealing with. So people like that, they are prone to getting this infection because their immune system is weak. So these are the kind of people who might get it. Okay, so here, just an overview of it. So mpox, like I said, is also known as monkeypox. Is an infectious disease caused by, hello Cindy Emmanuel, how are you? Please like this live stream. Mpox is an infectious disease. Remember, it's infectious. You can contact it. You can contact it. It is an infectious disease caused by the monkeypox virus. It can cause a painful rash, enlarged lymph nodes, and fever. Most people fully recover, but some get very sick. Just like COVID, some people get very sick that their life, they lose their life, and there's some people who recovered from COVID, and there's some people who did not fully recover from COVID, and those people are the ones who say they have long COVID. So long COVID means that all the symptoms that they experienced when they were with COVID, they will forever have that symptom for the rest of their life. Hello, Inim Love, how are you? Happy Friday. So this information that I'm reading to you guys, it's on WHO, World Health Organization. So this case I'm talking to you now, it's been declared as a global emergency. So you guys keep your ears out, okay? Keep your ears out. I'm surprised that there's not a lot about it being spoken in the news now. So I thought, immediately I go back from work today, I was like, we need to discuss this. I can't wait for a video. So anyone can get mpox. It spreads from contact with infected persons. And how do you get it from somebody who is infected? You can get it through touching that person, through kissing that person, and through sex. Yes, you can get it through those means. Okay, you can get it through somebody who is infected, through touching that person, through kissing such person who is infected, and through sex. You can get it through those means. You can also be getting from infected animals. So how do people get infection from animals? Those who go hunting. We all know in Africa, the way we be hunting bushmeat. You all know in Africa we hunt bushmeat, right? Bushmeat, hunting bushmeat, skinning bushmeat, and cooking them. So if a bushmeat is already infected, and all these people that are selling bushmeat and all of these things, they can be infected through animals. You can also be infected by materials as well, such as contaminated sheets, clothes, or needles. So if somebody who is infected with mpox uses a certain material, and you not being aware, you use it to cover your body, or you wear the same clothes as somebody who is infected, you will also be infected with it. If you wear the clothes of somebody who is infected, not knowing that they are infected, you will be infected. If you share needles or toothbrush, stuff like that, you will be infected. If you share anything that belongs to somebody who is infected, obviously you don't know that that person is infected, and you've gone on to use anything that belongs to them, you will be infected. So this one is just like, it's straightforward. With COVID, people are covering their faces, they're covering their nose, but this one, these are the ways it can be infected. It can also, if you come in contact with somebody who is also pregnant, So pregnant person may also pass the virus to their unborn baby. So if somebody is pregnant and they have it without knowing, they will also pass that virus to their baby, even though they don't know they have it. So guys, if you're pregnant right now, I will advise you to go and get tested. Okay, I will advise you to go and get tested. In love said, Lord have mercy. May God, may God. And I'm surprised that, just like I said, that I'm surprised and shocked that there's not a lot of it. It's not been, discussed in the news, even though World Health Organization already said it's a global emergency that every country needs to keep their eyes opened. Okay. Church TV said, God help the world. Amen. Oh. In him love said, the world needs God, oh, because the pestilence are already here. I tell you, my sister, I tell you. So that these are ways that it can be spread, okay? And here they said, if you have MPox, if you have monkeypox, tell anyone you have been close to recently. So if you had someone who has already had this virus, please, if you have been in contact with anybody, let those people you have been in contact with know, so that they can get tested. So this way they can rein in, they can reduce the way that it's been, spread across everybody. If you have mpox, you are advised to stay at home until all the scabs fall off and a new layer of skin forms. So just like if somebody have measles, you have to stay indoors until it dries off and then your skin is starting to heal. So that's just another way of this. If you have mpox, cover your lesions and wear a well-fitting mask when around people. So people who have this mpox, you are advised to cover your skin, wear clothing that will cover your skin, stay away from people, wear face masks, so that, because obviously you can infect anybody. If you already have it, you can infect anybody. And like I said, through touch, through kissing, even through physical touch, even shaking somebody, hugging that person, not knowing that they have it. Because some people, they will have this mpox but will not have those bumps on the skin. That's how dangerous this thing is. Okay, some people will have this mpox, they will only maybe possibly just have fever, they will only maybe possibly just have cold, maybe have the headache, maybe have the body ache, but will not have that bump on their skin. And so you not knowing that they have, and even that person not knowing that they have it, if you hug them, that's you. You've contacted it. If you shake their hands without washing your hands afterwards, that's you. You've contacted it. So maybe as the way with COVID now, people will start hugging people now, because you can never tell who already have it. And there's no way, like I said, some people will have it, the virus, but they don't have all the physical symptoms. So guys, I hope you guys are listening. Minim Love said, I heard of this monkeypox from my American friend year before last, if not last year. So, like I said, I think just like World Organization said here that there was a strain last year, but I didn't hear of it. It's only God that is protecting people. I did not hear of it. I did not. Maybe when it's full blown, the person will not have the bumps on their bodies. Maybe. And they said that, what, when people have the bumps as well, it takes up to 2 to 4 weeks before they are much better. Some people will have it easy, and some people could have it dangerously, like dangerous that it might even take their lives. So people, let us be very, very careful, okay? Let us be, maybe henceforth, no hugging, no shaking, no handshaking anybody. I still hug person at work today. Yes, I still hug somebody at work today, one of my colleagues. So it's only God that is protecting us. It's only God that is saving us. So let's keep reading. It says here that the disease mpox, formerly known as monkeypox, is caused by the monkeypox virus, commonly abbreviated as MPXV. So I'm not going to read all of that to you. So you guys already know that this mpox is also known as monkeypox. It's comes as measles, but big, big bumps on your skin. So let's go to transmission, how it is transmitted. So like I said, person to person transmission of mpox can occur through direct contact with infectious skin or other lesions, such as in the mouth or on genitals. So that's why I said that it can be passed between intimacy. So if there's anybody there who has multiple partners, please, nobody is telling you not to have multiple partners. So if that's how you want to live your life, but if you're going to be intimate with your multiple partners, you need to know their sexual health. Okay, you need to know their sexual health. And I think this is preachable for all sicknesses as well: HIV, STDs, all of those things. Like, if you're going to be meeting multiple partners, it's advisable that you know their sexual health. So in this case now, it's saying that infectious, you can be you can contact with infectious skin, or through the mouth or genital. So if you're kissing somebody, if you are doing bedroom dance with somebody that you don't know if they have it, you will catch it through there as well. And This contact also include face to face, even talking or breathing. If somebody breathes in your face, if somebody who has it breathe in your face, you will catch it. If you are talking to somebody and their spit accidentally drop on your skin, there's a possibility that you will catch it. So yeah, we are getting there, in him love. So I need you guys to understand how it's being transmitted, okay? You can contact it through skin to skin. So that's if you're being intimate with somebody without protection and you do not know that they have it. So touching or VJJ and back passage SCX, you can contact it that way. So these are physical contact now that they are telling us ways you can contact it. You can contact it mouth to mouth via kissing. You can contact it mouth to skin contact, that is oral SCX, or kissing the skin. These are the ways you can contact it. And you can also contact it, like I said, spit, respiratory droplet. If somebody coughs and their spit lands on your skin, you can contact it. Like I said, it's a virus that, physical contact. If you can get some physical contact, much more speed. So respiratory droplets or short range aerosols from prolonged close contact. So these are the ways you can contact. So let's go to signs and symptoms. So signs and symptoms, they said that MPox causes signs and symptoms which usually begin within a week, but can start between 1 to 21 days. So in a week, you might see symptoms, but it can start between 1 to 21 days. That means it's yes, more like airborne as well. So even though it's airborne and you can catch it in all ramifications, you can catch it in all ramifications. That's what they are telling us here. So it says that you can symptoms usually begin within a week, but can start between the first and between 1 and 21 days after exposure. So you might not show symptoms after 21 days that you've been exposed to it. So let's say you didn't know that you've been exposed to it with somebody, and after 21 days, that is when you're now starting to get symptoms. So it takes that long, and some people might be within a week. That's what they're telling us here. Symptoms typically last 2 to 4 weeks, but may last longer in someone with a weakened immune system. You remember, guys, I said earlier, people who have immune system, people who have maybe respiratory illnesses, people who have weak immune system, people who have underlying health conditions like maybe lung disease, who have COPD, who have asthma, who have cardiac issues, people like that. These are long-term illnesses and their immune system might be weak, so they are going to be more prone to getting this infection easy, and it might be very, very, life-threatening for them. So common symptoms are rash, fever, sore throat, headache, muscle aches, back pain, low energy, swollen lymph nodes. So you see all the symptoms, it's kind of like relates to COVID symptoms as well. So if some people might have it and they might think, oh, they have COVID. So please, if you think you have experienced any of these symptoms, please, like I said, the symptoms is kind of like similar to COVID. Please do a COVID testing. Me that I'm sitting with you now. Once I finish this live with you, I'm going to take a COVID testing because like I said, I've been feeling a bit and I've hugged people at work today. It's not as if maybe, like I said, you might not start to get symptoms until a week after or after 21 days, but the symptoms are COVID-like symptoms. So if you have any of these symptoms, please do COVID testing first. If your COVID testing comes out negative, I will advise you to go see your GP. There's a way they could take there's a way they could take sample from your GP to test if you have this MPox virus. Okay. So here it says that for some people, the first symptoms of MPox is a rash. So some people their first symptom might be the rash, while others may have different symptoms. Like we have different body systems, so someone else might get the rash and somebody else who has this mpox might not get a rash until after 21 days, but they might be experiencing maybe headaches, they might be experiencing feeling of lethargic, they might be having low energy, they might not have the rash. Okay, so they said here that the rash begins as a flat sore which develops into a blister filled with liquid and may be itchy or painful. Okay, hello Abby Crystal, how are you? Good evening. As the rash heals, the lesions dry up, cross over, and fall off. So if the lesion forms, it dries up, and once it dries up, a new skin will come. So that way, that's you're getting healed. In the blood step, in my country, we still conduct COVID test every day, especially if you are sick or getting ready to undergo surgery. I got myself tested in February before my surgery. Funnest thing is this: when I had my gallbladder surgery, I was not tested. Yeah, I was not tested for COVID. but they asked me for respiratory, like, when have you do you have they just ask question like, do you have any COVID like symptoms? They asked me those questions, but I was not tested for COVID. And I was surprised. In fact, I'm not surprised because I work, like I said, I work in theater. So when we go to collect patients, they no longer test for COVID. They just ask you the question. Obviously, they will check the sign. If your temperature is above that something, they will ask if you've ever have any continuous cough. So these were the questions they asked me when I went for my surgery. Do I have any new cough or any continuous cough that has been more than 2 weeks? They asked me that. They asked me if I have any fever or what my temperature was, and my temperature was normal. So that was the only question I was asked. But nowadays, if you're coming into surgery, the thing they take really, really serious is MRSA. MRSA, like, where they take a sample from your nose and a sample from the back of your throat and a sample from your VJJ. They took all of that, but still with mine as well. They didn't do that testing for me. I was not swabbed for MRSA or anything like that. Obviously, they will ask you if you've ever had any issue of MRSA, but for me, I was never. Maybe because it was a day surgery, but I was never tested for COVID, and I was never tested for MRSA. Obviously, they did bloods because I had a pre-assessment. So I had a pre-assessment 3 weeks before I was due to have my surgery. So they took my blood. So obviously, there are so many things that could be revealed via blood test. So they took my blood, and the lady said if your blood is off, they will ask you to come back and do more tests. But I was not called back, which means that all of my bloods were fine. So yeah, Abby said, "What's this pandemic? It's monkeypox. Monkeypox. Okay, you guys seem to be very, very careful. The symptoms is like that of COVID. Okay, so if you think you have any of these symptoms I've mentioned, it's advisable. First of all, you take COVID test. If your COVID testing said negative, please contact your GP. Say this is your symptoms, and there's a way they will take a sample of you to be sure. And it's advised that if you have any of these symptoms, that you stay indoor. And if you've been around people in the past few days prior to you feeling these symptoms, is you've been advised to let them know that this is how you're feeling so they could get tested and so they could also shield themselves and not go about meeting people. Okay. Inim Love said, I was tested and the result was given on the spot. Then I was operated on upon. I know it's strange, like my where I work. No, they don't. But I would believe that those, if you're coming for like a cardiac issue, cardiac surgery or stuff like that, they do all of those tests. But people who come for um other, like I said, when I went to remove my gallbladder, I was not, maybe because they've already taken my blood prior to me coming in. So obviously that means that I was fine to go in, but I was not COVID tested. I was not MRSA tested either. The only thing they did was pregnancy tests. Yeah, the only thing, if you're in your early 40s or if you're sexually active, yeah, they did I was given a dipstick to do a pregnancy test for myself. you know Inim Love said, yes, I did my blog work as well, as well, some to the day. They still did the COVID test. Some patients can lie, so they didn't want to take chances. Remember how the COVID, yeah, exactly, I understand. Yeah, so I guess different L boards in the UK do something things differently. So just like I said, so those are the common symptoms. Common symptoms are rash, fever, sore throat, headache, muscle aches, back pain, low energy, swollen lymph nodes. So these are common symptoms. If you experience all of this, you can see those symptoms look alike. It's similar to COVID testing. So if you have any of these symptoms, please carry out a COVID testing first. If your COVID testing said negative, contact your GP straight away. Okay, so they could take sample of you. And like I said, some people, their first symptoms might be the rash. For some people, they might have different symptoms first. They might, maybe it's the swollen lymph node they might have instead of the rash. So our body is different, so we might have different symptoms. And also, they've described the rash. They said that the rash begins as a flat sore, which develops into a blister filled with liquid and may be itchy or painful. As the rash heals, the lesions dry up, cross off, and fall over. So that could take weeks. It could take 2 to 4 weeks for all of that to happen. Okay. Some people may have one or a few skin lesions. Yeah, some people might just have one skin lesions. With measles. Okay, some people might just have one. I remember when my kids were babies. I think my son only had maybe like four. And by the time I took her to the GP, when I took him to the GP said it was measles. And I remember that when I was a child, when I was in my young teen, I think I was 13, I had measles. It was all over my body. And my daughters, when they were between the age of 5 and 6, they had measles. It was all over their body. But when my son had measles, it was just like 4 spots. So that's what they're trying to say to us, that some people might have just one lesion, while others will have hundreds or all over their body. Okay, this can appear anywhere on the body, such as you can have it in the palms of your hand, in the soles of your feet, on your face. I've seen people have it in their gums. I was watching some videos before I came live. Some people have it in their gums, like you can see their gums swollen. So symptoms, you can have these lesions anywhere in your body. In your, they said you can have it in your back hole. You can have it there. You can have it in your groin. You can have it in your genital area. So you can have it all over your body. And some people just have one on their face or on their arm, something like that. So our body is different. Okay, like yeah, that Inim said, the symptoms will vary. Okay, and he said that some people also may have painful swelling of their rectum or pain and difficulty when peeing. So pain and difficulty when peeing will maybe apply to female because, like they said, you can have it in your genital area, so it might be inside. Okay, so you guys please be very very mindful. Okay, so that's what they've told us that you guys know already about the symptoms. Okay, and how it is being transferred. So here they said how is it diagnosed? How is it diagnosed? Okay, so they said identifying MPox can be difficult as other infections and conditions look similar. You know, I told you guys that the symptoms look similar. It is important to distinguish mpox from chickenpox, from measles, from bacterial skin infection, from scabies, herpes, syphilis, and other STDs and medication-associated allergies. So some might think maybe it's an allergy to a medication. Some might think maybe it's scabies they've got. Some might think it's syphilis or herpes, but you know because the symptoms look alike. Okay, so diagnosing it might be difficult. All right. So here it says someone with mpox may also have another STD such as herpes, blah blah blah. Alternatively, a child with suspected mpox may also have chickenpox. So they are saying now that a child who have mpox could also have chickenpox. So hence why it's difficult for it to be diagnosed. So God will help us. So like that thing they saying is a difficult thing to diagnose. This one for my hand. So for these reasons, testing is key for people to get treatment as early as possible and prevent further spread. Okay. So they said that the detection is provided by laboratory test. Okay. So and they said the best diagnostic specimen are taken directly from the rash. So obviously somebody will have had it, or if somebody has a rash, then they will take a specimen from the rash or the skin fluid or cross collected by vigorous scabbing and stuff like that. So they said in the absence of skin lesions, testing can be done on oropharyngeal, anal or rectal swabs. All right, okay. So they said now that other areas they can check the testings, like when you do MRSA, the way they will deep stuff into your cocos in your nose. When they are doing COVID tests, how they will throw it up your nose. They can get sample via there. They said they can also get sample via the your anus. They can get sample via there, and they can also take rectal swabs as well. So I mean that's not bad. So some people might not have these lesions, they might not have this rash, but these other three areas, I mean, they can easily take a sample via there, and which is good. So they said testing blood is not recommended, that they can't test it by blood. Antibody detection methods may not be useful as they do not distinguish between. All right, okay. So that's pretty much how it's diagnosed. So I think the easiest way of diagnosing it for people who don't have the rash is taking the oropharyngeal test, anal or rectal swab. So these are the three, I would say, maybe easier way of getting a sample. Yeah, they will take sample from GJJ. So exactly, yes, they can do that as well. So they now said that in terms of treatment and vaccination, the goal of treating mpox is to take care of the rash, manage pain, and prevent complications. Early and supportive care is important to help manage symptoms and avoid further problems. Okay, so getting an mpox vaccine can also help prevent the infection. So now nobody's been talking about this vaccination. So is it a matter of phoning your GP and say, "Can I get the mpox vaccine?" Because there are still some people who are still stronger saying that they don't want to take the COVID vaccine. Me, I took all the COVID vaccine. In fact, they even offer us extra. I took it, and to God be the glory. Touch wood. Nobody in my household has ever had COVID, and we will never have it in Jesus' name. And this one that is also out there, none of my household or none of you will ever get it in the mighty name of Jesus. So if they are willing to give the vaccine, I'm happy to take the vaccine. I'll be taking it. Okay. So they said that the vaccine should be given within 4 days of contact with someone. But then, how do you want to know if someone already has it? Well, just like they said, if you think you've been exposed to somebody and you've let somebody know, that these are my symptoms, I just said I should let you know because they are saying here that the vaccine should be given within 4 days of contact with someone who has MPox, or within up to 14 days if there are no symptoms. May God help us. May God help us. So it says that it is recommended for people at high risk to get vaccinated to prevent infection with MPox. So people who have low immune systems, that will believe that they'll probably be the first people that they'll be giving out the vaccine to. And especially during an outbreak, this includes health workers, men who have SCX with men, people with multiple SCX partners, and SCX workers. So these people are people who will probably be getting the vaccine first, because obviously those who have multiple sex partners, men and men together, and these are probably the people who are going to be prone to getting this mpox, so they'll probably be getting the vaccination first. So, and they said that if you have the mpox, it should be people who have this mpox, we should be treated in a confined space, so you have to be away from other people so you don't spread it. But as it is now, it's spreading rapidly in Africa. Like there's 36 cases of mpox in Nigeria already, and I was listening to BBC News earlier on. It says that it's even more rampant amongst children. Okay, it's more common amongst children. So I don't know if I don't know if any death has been recorded yet, but in Nigeria, when I was reading that post there, it's more common. I mean, not Nigeria alone, other, like I said, there's a lot of it in 16 African countries now. And they said most of the people who are actually suffering this a lot are children, because obviously people might just think it's measles or chicken pox, not knowing that it's mpox. And for a parent who is caring for a child, not knowing that it's mpox, the parent too will get infected, and that's how they are spreading it. So um that's that being said. So self-care and prevention. They said that most people with mpox will recover within 2 to 4 weeks. Things to do to help the symptoms, and things you should do: stay home and in your own room if possible. Okay, wash your hands often with soap and water or hand sanitizer, especially before or after touching sores. So these are the things we should do if you think you've been exposed to somebody. Okay, wear a mask and cover lesions when around other people until your rash heals. So if you have symptoms, or you already have mpox, these are the things that they're asking you to do. So if there's any of you watching me out there and you already have this virus, please stay at home, and if possible in your own room. Don't come out, don't move around with people. And they said it's going to take about 2 to 4 weeks for the symptom to subside. Wash your hands with soap and water, or hand sanitizer if you touch somebody, or if you touch your wound. So maybe because they said it's going to be really, really scratchy. If you touch it or you've scratched it, wash your hand or sanitize your hand. Wear a mask and wear a cloth that will cover your skin lesions, so that other people around will not be exposed to it. Keep your skin dry and uncovered unless in a room with somebody. So if you're in a room with somebody else, you can wear a cloth to cover yourself. But if in your own personal room, they said you should leave your skin uncovered. Okay. Avoid touching items in shared place. So if you're in a place where you are sharing things with people, they said avoid touching things you share that other people are going to be using. So it's just a matter of either you have your own, just like COVID, maybe have your own spoon, have your own cup, until you get better. And then once you get better, you can go back to normal. They said use salt water to rinse. So if you have it in your mouth, they've advised that using salt water to rinse could help to relieve the pressure and the pain you might experience. And they've advised that you should take warm bath, warm bath. So people who don't have baths, maybe do warm shower. Okay, warm shower with baking soda or Epsom salt for body sore. So if you have all these lesions on your body, if you don't have a bath, take a warm shower. Obviously, in order to put the Epsom salt, maybe get a bucket, fill it with warm water, add your Epsom salt, and take a wash that way. And also take over the counter medications for painkiller like paracetamol or ibuprofen. So they are not really prescribing heavy or high dose or controlled drugs as for pain. So the painkiller they prescribe here is paracetamol and ibuprofen. So that's what they've advised you to do if you already have this virus. And this is what they've advised you not to do. They said do not pop the blister. So if you have the blisters, don't pop it, you don't scratch it, because if you pop or you scratch it, it's going to take forever to heal, and then it might spread to other parts of the body. Just like if somebody has one, and because you have itchy finger, you post it, it might eventually spread to the rest of your body. So don't itch, don't scratch. If you do, it's going to spread to the rest of your body, and it might even, your source might even be infected. Yes, which means it might even end up needing antibiotics. And then as it is now, we don't know what antibiotics that this thing might be able to, but that might work with this virus. So they've also said Shave areas with sores until scabs have healed. So if you have any area on your skin that has the scab, shave it off. So I remember we used to use sandpaper. Remember when we have lapa lapa, this ringworm, when children have ringworm on the head. So if you have something like that, sandpaper, sand loaded, that's what they've said here, that you should shave areas with sores until scabs have healed, and then you have new skin underneath. This can, spread the rash to other parts. Don't They said do not, don't do it. Don't shave just because you think, oh, that skin is dry and you're now shaving. No, they said don't do it, because if you do it, your scabs will not heal. Your new skin underneath might be, be infected as well. So, and it might also mean that this rash is all over your body. So avoid scratching or shaving the dry skin. Okay, so that's pretty much all I've come up here to share with you guys, that it's been declared by World Health Organization as a global health emergency. So guys, you know what is it's surprising that 2 weeks ago I was in the supermarket and I saw a lot of Chinese people wearing face masks, and I was wondering, like, why are they wearing face masks? Why are they wearing face masks? I've not even heard of this MPox. So, and I'm like, why are they wearing face masks? That people are just happy to be free of COVID. And some people are happy wearing face masks. That me, I don't want to go back. Like I see when everybody was already going about without face masks. For when I was at work, while I work, we continued to wear face masks for almost 3 months after it's been said that everybody should stop wearing face masks. I thought I was going to die, because you can imagine, I finish work on a Friday, you have the weekend off, no face mask, and then you go back to work on Friday. You are going with, "Hi Stardust, how are you?" And then you go back to work on Monday, you are back to face mask. Every time I go back to work, I feel as if I'm going to suffocate with face mask. So just like I was saying, 2 weeks ago, I saw hello Hamira, how are you? Happy Friday. I was surprised when I saw these Chinese people wearing face masks and gloves. So which means that they probably have an idea, or they already heard the news about this mpox. So I don't think I'm ready for wearing face masks again and wearing hand gloves again. I just hope that they share this news so that everybody's aware, and they share more on how it's being passed across and how it can be prevented. And like I said, if you experience any of the common symptoms, the first thing I will tell you guys to do is take a COVID test, okay? And once you take a COVID test, if the test says negative, please speak to your GP, okay? Say that, this is the symptoms you've been having. You've heard about the monkeypox. That is there a way you could maybe send a kit so that you could take the sample yourself, and because at the end of the high stardust, how are you? Because at the end of the day, if you are possibly infected, you've been advised to stay indoors. So the GP will not want you to come to their office if they think you are infected. So I would imagine that they will be happy to send you a sample kit to take the sample yourself, and they'll tell you where to post it to. So guys, this is just information I really want to come and share with you guys. And please guys, if you have any of you have any further information, please feel free to share in the comment section so that people are aware of it. Because like I said, not a lot of media houses are talking about this. And if you're planning on going to Nigeria at any time soon, please make sure you have, like, get further information, because people are saying that if you don't get this you have to commit you have to fill a L declaration form, just like with COVID. Because I remember when I was going to Nigeria in 2021, I had to do L declaration form, I had to do COVID testing 24 hours before I was due to fly. And then I have the result with me to show to them that I'm COVID negative. And then upon getting to Nigeria, I have to do COVID testing 24 hours after I got to Nigeria, and then do another one 24 hours before I leave Nigeria. And then after that, I was to make sure before I enter into the UK, I have to show evidence that I've already booked my COVID testing that I'm going to do for day 7 and day 14, and it was not cheap. So I can see this happening as the same thing as it, because like I said, World Health Organization has already said this is a global health emergency. So I was reading comment now. People are like, "Oh, close the borders, close the borders." It's not a matter of closing the borders. It's educating people, let people know. Because I felt the fact that COVID did the way it did in the UK was because most people were not aware. Most people were not aware. Like, the people in China already knew about these things. But then in December, some people in the UK felt they had symptoms, but they were not sure. It wasn't until late January, early February that in the UK that they realized that, yeah, COVID is yakpa inside UK. So with this now, I'm hoping that they will start spreading the news the more so that people are aware. And me bringing out this information, it is not to upset you. It is not to make you panic in any way. It's just to help you keep your ears out, keep your eyes open, and be conscious of where you are in your environment. See, everywhere I go, I have hand sanitizer. If you see the big tub of hand sanitizer in my car, I have one hand sanitizer in my car. I have one in my handbag. My handbag, if I open it for you, there's about three mini ones that I clip is in my handbag. In my locker at work, I have hand sanitizer. It's not because I heard about this. No, I've always had hand sanitizer since COVID. I have that, and I have some hand moisturizer that work as hand sanitizer. So let's be in the act of having hand sanitizers on us. If you're going shopping, in fact, I need to go and stock up on gloves. Now, if I'm going shopping, I'm taking hand gloves with me. Okay, because you are touching trolleys, you go into the shop, you are touching baskets and stuff like that. So all of this is, let us be very, very aware of it. And immediately you get back home, please rinse your hand, clean your hands and stuff like that. And also let's encourage our kids as well to wash their hands immediately they come back into school. And if you can get your kids those mini hand sanitizers, please get it for them as well. If you can't get the liquid one, get the hand sanitizing wipes. They're like in a very small, compact wipe like that. Put it in their bag and say to them, you know what, when you finish from school, if you get off the bus, wipe your hand before you eat and stuff like that. And then when they get home, encourage them to wash their hands. Okay, encourage them to wash their hands. Children in this country, they don't like to take their bath. I'm a witness. I have my kids, especially my boys. They don't like to shower. They know they like to bath at all. Them and bath na fight. How long ago did you shower? So encourage them to take a shower once they come back from school. So that way, they've washed the germs away. Their uniforms, immediately they come in, chuck it straight to the washing machine, do a hot wash. All right. So I think these are the things we can start doing now. Don't let us wait until these people come and start giving us information. And by then it will have been too late. If you want to read up on this information, just go onto the World Health Organization website. It's Gadagba is there, and I think BBC has already started reporting about it as well. Sky News has already started reporting about it as well. So far, I've not heard about any case in the UK, but for the fact that it's in Europe, the person that already got one in Sweden, we don't know how many people this person has been in contact with. We don't know. We don't know if they've traveled. We don't know where they've been. There are people who are coming from Nigeria into the UK. We don't know if they have this. So, they should close the borders. Well, if that's like if that's a good idea, and I would imagine maybe that would happen at some point, or they might just start the same, just the way they did with COVID. They might start asking people to do tests and stuff like that. But we'll see. I just felt them know, for you people in my community, because I care about you, we care about each other in this community. I felt no, I need to bring this to you guys. These guys have to be very, very vigilant. Try and stay safe. Okay, plain spread bugs. Absolutely. Let me tell you guys one lie. So you all know I went to Turkey with my kids, and I got this. In fact, I don't even know where I dropped the wipe now. It's a massive antibacterial wipe. Okay, so I bought that wipe. I intentionally put this in my handbag as I went onto the flight. So I made sure that me and my kids, we were sitting together. So six of us, our seats were together. And when we got in, I picked my wipe. I wiped all the seats that were sitting on the flight. Oh. I wiped my own seat from head to toe. I wiped all of my kids. People were looking at me like she's crazy. No, because I know that it's on the flight that you get lots of jams, because the flight that we took has just brought people from Turkey, and when they clean, they don't clean it as much. So they brought people in from Turkey. We don't know what the kind of stuff these people have. So, and that flight, they'll probably just empty the bin, it replace whatever it is that has been used. I don't think they even replaced anything, because I think it was Thompson's yeah, it was Thompson's local that we flew with. Before I got my seat down, my kids to sit down on our seat, I wiped all the six seats. People on the flight were like, we were moaning. I'm like, oh, you guys need to just chill, take a chill pill. I'm wiping this down. I wiped my seat, the handles, the tray. I also passed it, I passed it to my kids as well. People were looking at me. So we should be, let's start doing things like this. If you're going to supermarket, take your antiseptic wipe with you. Wipe the trolley. Amen, Larissa. Wipe the trolley, wipe it and discard of that wipe into a bin. And if you don't have an antiseptic wipe, if you don't want people to be looking at you funny, wear gloves. I told you guys that I saw some people 2 weeks ago that are wearing face masks and gloves. If I knew, they probably have information about this that we and me, I'm just bringing out to you guys now. So that's their own way. So if you're going to be in a close vicinity with people, try and leave, minimal space, so that you're not too face. So me now, with this fact now, when I was at work today, I was very, very cautious of how I was in the vicinity with my colleagues, because I don't know who has anything. So normally we are in a nursing bay, and that nursing bay is not big, and then we'll have like 8 of us there, chatting away. But today I was like, I tried to keep my distance, and I'm sure they were looking at me funny, like, what's wrong with women? You know, Yeah, loved ones. It says, yeah, like you were late. So if you have the time, try and watch this video from the beginning. You can contact the physical touch. You can contact it if you have multiple sexual partners. You can contact it through kissing, touching, holding, handshake. Yes, you can contact it and droppers as well. If somebody's talking in your face and they, people who talk with spit flashing. If you talk with people like that, spit coming out of their mouth. If it drops on your skin, you can catch it as well. So guys, I just felt I'll do use all a duty because, like I said, I care about my community. I care about each and every one of you. You might not believe it, but I care about you. Larissa, yes, it's like the symptoms are very, very similar to COVID symptoms, okay? Maybe they've not mentioned anything like loss of taste, but there's lack of energy, headache, what's it called again? I'm just gonna read the symptoms here. Let me quickly scroll down to my laptop here. So the symptoms include rash, fever, sore throat, headache, muscle pain, back pain, low energy, and swollen lymph nodes. So, guys, just keep an eye out for those symptoms. Like I said, if you experience any of these symptoms, best bet take a COVID test because those symptoms are similar to COVID. Okay, if you don't have a rash, it's similar to COVID, but if you have a rash, just like they said here, you might think it's chickenpox, you might think it's measles. Don't assume. Just take a COVID test. If your COVID test comes out negative, then let your GP know to say no. You've had the symptoms. You have a rash. They might be able to send you a kit to take a sample, and then they'll tell you where to where to send it to them sample to. So I'm going to quickly recommend, and then I'll end this live stream. All right, guys, please like and share. Okay. Um Play spread bugs, exactly. Inim Love said they will be locked down to die. I hope not. Oh, I don't think I can survive another lockdown. Inim, please. Oh, I'm not praying for another lockdown. Biko. No to lockdown, please. Hey, it is we nurse health workers that we will keep going to work. I don't want no lockdown. Love oneself, the government and CDC don't care. That's why I said that there's not been a lot of news channels reporting about it. So before I came onto this live, I've only seen one report so far on BBC News on YouTube, and then I saw a news on Sky News page. That's just the news so far that's giving me notification of the stuff. So you would expect that while at work today, like the NHS, the health services will have information and let us know. But nothing was passed across at work today. I was like, oh, maybe because I started half 10 this morning. Normally I started half 7 because I had an extra time. I started later and I was like, oh, maybe they've already done the brief. I went to check the notes where we write the brief. There was nothing of such. I was like, what's going on? So maybe they are still trying to hush hush because they don't have a case in the UK yet. But by the time they will have a case in the UK, you will have. So, guys, for the fact that I've come to share this, don't panic, okay? Just prepare yourself, get hand washing, get sanitizing things, and stay far away from people. Like avoid touching, hugging. If anybody wants to shake you, tell them I'm sorry, I can't shake you. There's a new virus. That way you are helping pass the information so they are aware as well. Okay. Um Larissa said, yeah, I like to wipe the ATM down. ATM, okay. I can't remember the last time I used an ATM, but that sounds like a good idea. So when I go to ATM, if I will have driven, I use my car keys to punch the key on the ATM. Even when I'm getting in the lift, I don't use my fingers to touch the lift. I use my car key or my keys, any of the key that I have to punch the number. So yeah, I better start going about with more gloves now. That loved oneself, the world is so dangerous, and that it is, guys. So we have to be very, very careful. Keep your immune system super boosted as well. Yes, eat healthy food, eat food that's going to boost your immune system, do all of that. And if you have underlying health condition, just make sure you're using your medication, make sure you're attending your appointments, just make sure you keep yourself safe. Okay. Larissa said, I wonder if there are maybe skin oils that can help with prevention. Skin oils, care. I don't think so. I don't think so. If you any skin oils, if anybody's going to be intimate with anybody, you need to. If it's a new partner, you need to be aware of their like their sexual health. If you need to go private, go private. Or if they don't want to go private, it's better you don't do anything with them because at the end of the day, if you use a CD, if you use CO, if you use protection, there's still a possibility that while you are chesting with them, you could still be infected. So it's better if you're going to be intimate with somebody who is new, find out about their sexual health. Okay. Because even as it is now, condom no go do anything for you. I'm sorry. In him love you. In him is true. You're welcome, princess. You're welcome. You're welcome. Larissa said, "Oh, that's a smart move to use the keys of the ATMs, boss." And so I'm going to do, yeah. Any key that I have with me, I just use it to punch the numbers, or I use my knob. See, I use it that way. And immediately I go into the shop, I just make use of their hand sanitizers. That's what I do. But most times I use my keys to punch in. If I'm getting in the lift, I use my key to punch the number as well. I mean, since COVID, that's like I just continue with that habit. I just continue with that habit. Like coconut oil, or I don't think so. No. Mm-mm. Love oneself. Just stop having sexual relationships. Well, it's better if you've been with just the one person. Obviously, because you've been with that person, you will know their sexual. You will know um their sexual health. But then just know yourself for tell yourself, because you don't know if that person is benching somebody else. So even if you decide to use protection, if you come in close contact with them, touching them, kissing them, you can still, you know. So if you are single, don't be benching anybody. If you are single, just abstain. Abstain, okay? That's what I'm going to tell you. Because even like I told you, protection, long john is not going to do anything for you. So abstain. I mean, it sounds funny, but we need to be. Mm, I'm being honest with you guys, okay? And they've already listed that people who are prone to getting this, who are probably going to get vaccine, men to men, being intimate, people who do anal, who do all of those stuff. They are the people who they think will be first exposed, and possibly they will probably be offered the vaccine first before people like us married with family we get the vaccine. So me and some of you are, they might probably be the last people that will get offered the vaccine. But if they offer me vaccine at work, I will take it too, because they obviously want to consider frontline workers as well. So if they offer me vaccine at work, I will take it. I will take it. Um, love oneself, just stop having sexual relationship. Okay, oh, I hope they listen topically. I don't think so, Larissa. So it's best either you get an antiseptic, an antibacterial wipe, and gloves or something. That's the way I think you can protect yourself as it is now. Thank you very. You're welcome. You're a good talker. Oh, thank you, Larissa. Thank you. I really appreciate that. Singles lock up. You've been told, oh, in him love. Chioma Ileoye, Eka Leo. You are late. Let's come at Chioma. You've been warned, though, singles. I know. I said I want to go and start doing maybe freaky talk on Friday, but this talk is freaky talk, as a freaky talk don't enter as well. So we need to be, don't be freaky this time around. If you want to be freaky, stick with the one person. Don't introduce new partner, or partner that you don't know their orientation, or you don't know their sexual health. Do not, do not. Okay, if you think if you use long john will not save you, I'm telling you. Otoro truth is bitter, but I'm telling you. Love oneself in the 1980s said the same thing about HIV, that only now everybody gets it, so because most of them now, it's only made, they do other people. There are some people who, even though they are men to men, but they still do women as well, and that's how all these things spread. So people lie, exactly. People lie, so don't trust anybody. Zip up, exactly. Zip up, and girl, no, close up. Go be monk or a nun. Love oneself, I will not be fooled. Do not. Right, anyway, guys, I hope we all get the gist. I just felt, no, I'm gonna bring this information. I will try and maybe, I already recorded a video. I thought I was gonna share that video, but editing nowadays they tire me. So I might maybe do that video for people who might not want to watch this 58 minutes long video. But please, guys, I really appreciate if you share this video. Share, let other people know as well. And yeah, that's just that. Like I said, once I go back to edit this video, I'll put the link of WHO under the video, so that you can click on that link and go read more, because there's a lot of other stuff that I jumped. But I've just shared with you guys how it's been transmitted, how to prevent it, the symptoms that we need to be aware of. So anyway, guys, thank you so much to you all. I really appreciate you all. I need to go watch this tired face, and I'm tired. I've been to work today. I'm exhausted. So if you're going to be watching this live stream again, please engage. Let me know what you think about this virus. Do you think they should? I think they should be sharing information about it now. Maybe if I go back onto YouTube or something, there might be other news channels talking about. But I'm surprised that even Nigerian media are really not saying much. The only place like I said, the only place I found it was on, I think, Instablog Niger was the only gossip page that spoke about this. And then Sase Funke, who talks about traveling to Nigeria, was the one who shared the information of that. If you're going to Nigeria, that the Nigerian Ministry of Health now requires all travelers entering into Nigeria to complete a health declaration form. So if you travel to Nigeria during the COVID period, you fill a health declaration form. So that's that about now. So I hope you guys found this information helpful. And if you're not yet subscribed to my channel, what are you waiting for? So don't forget to like, subscribe, and also you guys, I'm receiving super chat though. Okay, I'm doing the Lord's work, so you should you should bless the Lord's work that I am doing. All right, and hopefully I'll see you guys later again. And thank you so much to every one of you. Have a lovely Friday. I've got my Chinese here that I want to dig into now. So have a lovely Friday and hopefully have a lovely weekend as well. And I shall see you all in my next live. All right, and have a blessed night as well. Much love to you guys and please stay safe. All right, bye everyone.